So really the purpose of this survey and the presentation was to see how practices are currently within Broomfield and the behavioral health providers' use and understanding of the medical home practices. This survey was distributed on the 18th of August and closed September 22nd. We identified 35 behavioral health providers within Broomfield and a 5-mile catchment of Broomfield. I had 20 respond to the survey. So all of our results will be from the 20 providers who responded. The Colorado Medical Home Initiative and also CDPHE and HCPF and now CDHS have identified these standards and measures of medical home. And that's what many of the survey questions were based off of, is the accessible, comprehensive, compassionate, continuous, coordinated, culturally sensitive or culturally competent, family-centered delivery of care. And that's how we start with health integration, is by identifying these standards and trying to define them within each practice. So we'll start with accessible. An ease of services. Insurance plans are accepted, the availability of appointments, and just physical location of them. That's how we can gauge how accessible some of our providers are. And I start with Medicaid, simply because it is a difficult issue to talk about, and it's difficult to see clients with Medicaid because of so many of the barriers and so many of the issues that come with Medicaid. So 55% of our respondents do not see clients with Medicaid. But of that 55%, 63 would consider taking Medicaid clients. Looking at the demographics of Broomfield, there are 10.6% of kids on Medicaid. So we understand the barriers to accepting Medicaid, and really there is not a huge need for Medicaid currently. And these are the types of payments that our providers take: fee-for-service, private insurance, EAP, and then the Medicaid there is a portion of what some people will take too. So when we're talking about triage service, it's if your clients can contact you or see you or however they may be able to access you for imminent needs. 72% do not have a triage service. Many of the insurance mandates for service to be at the emergency room if it is life-threatening. So oftentimes clients will just simply go to the emergency room instead of accessing any type of care from behavioral health providers. As far as appointments go, many of our providers do provide evening appointments. An incredible amount provide evening appointments, which is a fantastic figure. And also the majority of the providers will provide Saturday appointments, and even some will do Sunday appointments. So access to care, access to the providers themselves are at unconventional times. Coordinated. Coordinated care is a partnering or working with the family and child to develop a plan. Share this with other organizations, providers, agencies who are working directly with that child. This will help give a coordinated care for a child with a global view of any conditions or behaviors that this child may be experiencing. So when asked the primary care physician, the PCP is typically a doctor that families and children will go to whether they're sick or they're well. And so the PCP is a physician that will see clients and families very often, and they're often a primary point of contact with any type of medical issues or medical needs. So when asking if you do have any type of coordinated care or communication with or knowledge of the PCP, it can definitely help to account for changes in medication, identify any other issues that may in turn manifest into other realms of the child's life, for example, family life or early learning life. So having this communication and this knowledge about what each provider is doing is a key issue for medical home and coordinated care. We also, anecdotal information will obviously say that health services in an office, within the same office, or on-site service or referrals will definitely help to coordinate care, as the client can move out of one door and just turn the corner and be in another type of treatment plan or be in another type of care. So that will certainly help the follow-through and help coordinate the care a little bit more easily because of the physical locations of it. And 63% of our providers have said that they do not have the on-site service or referral, so 37% would. Coordinating with PCPs are a crucial component. However, when other services are identified, having connections with other specialists can help in that care coordination as well, because it doesn't always go through the primary care. You might understand that there may be an audiology problem or a dietitian problem or any other type of specialist. So reaching out to more than just the primary care physician can be a sign of successful coordinated care as well. So 63% have indicated that they do have partners or they do have connections with these specialized treatments. And when asking about a policy on information, this question did come up several times, but the policy, it is again anecdotal, but when you have something written or an actual concrete understanding with another partner and that is followed, it does demonstrate sustainability and it does demonstrate a continuous type of care. And so when asked that question, 77% of the people do have a policy on how that information is shared. That policy would include any of the DIS releases, the HIPAA releases, the FERPA releases, and any of those that may come with it. Coordination of care and medical home can also start within the behavioral health practice as well. So once you have made a treatment plan or a diagnosis, do you share it with others? Do you share it with other people that are within the child's realm of care? So when asked if they did share these treatment plans, 68% responded yes. And that by sharing this, it can help give support to the family and it can also empower them, knowing that they are cared for and knowing that they are being held accountable to many other providers and not just one, will improve the health of this child. Some of the barriers for not sharing these treatment plans, you'll see the two main ones are the lack of time and the lack of contacts. Medical home and health integration, this is where some huge interventions can come with the lack of contacts and the lack of time. Lack of context, medical home, and the coordinated care effort, and the health integration, the work that I'm doing, will help to open the doors to other partners and to open the doors to networks of other people where you can get contacts and where there is information. And the communication between the family and the other providers will be greater and more sustainable because there are other points of contact. So again, the question is asked, is there a communication system in place to be able to receive and give information on clients directly from other providers regarding your client's health? So really just closing the loop. If you have information, are you sharing it? Are you sharing information and are you hearing anything back? This whole loop of communication, is it there? This survey has indicated that no, it's not really there. And that's again where health integration can certainly help to intervene with the no response and create some more partnerships. Again, barriers to communication. There is the system barrier that could be huge, but then the lack of follow-through and the commitment from other providers is a big thing. That closing the loop on communication, closing the loop on information so that you have those resources to know where that child's been and the care that's been received. Health integration philosophy can bring together all most health providers so that the main barrier to communication and coordination can be solved.